Guys, I can't open my eye, like, literally.
I hear you been asking about me, where I've been and where I sleep. It's hard to find me if you really want to. Turns past that takes a cool sign. Same ball cap, same moon boots. Trying to outrun the 40.
Almost 24 hours since I got laser tattoo removal of my old permanent eyeliner, and I'm going to answer my most frequently asked questions. Top one being, what is going on with my eyelashes and will they fall out? So they turned white for the most part, and they'll probably be pretty brittle, but they're going to grow out normal color. At least that's what they say. As you can see, they're very light, and I normally have dark eyelashes. The next question is, was it painful? And the answer is yes, it very much so was. So they numb with lidocaine. They put in some numbing drops and then some jelly and then put in the shields, which that part honestly was not bad at all. And then even the lidocaine, I was worried about that part. They gave me a little like vibrating tool and they put it right here as he was doing the lidocaine injections, and like the vibrating here just kind of makes you feel like you have to sneeze. So that was enough of a distraction that the pokes and the burning from the lidocaine actually wasn't that bad. And I think they left for 5 or 10 minutes to let the numbing work, and they came back and I was like, oh, I'm not going to feel anything, but I definitely felt it, especially this eye where it's thicker and there's more outside of like the line and it's bled more. I don't know if that's why it hurts, because it's pulling from deeper and like trying to get it at, or hitting it from deeper. But this eye hurt so bad, but it was so quick that it was honestly fine. And then this eye honestly wasn't that bad. There was a couple spots that I could really feel it, but for the most part, this eye wasn't that bad. Right after, it hurt, but I was also numb, and like it was so hard to open my eyes. Like they took out the eye shields, and then she's like, you can open your eyes. I'm like, I literally can't. And she like flushed out a lot of the goop for a while, and it was pretty blurry, and my eyes just felt so heavy from all the lidocaine, and they were so swollen that I could barely open my eyes, it felt like. And luckily I had a driver, so my husband picked me up. I don't know how you could drive home after that. And then afterwards, it was pretty sore, but I think doing the injectable lidocaine made it so that it wasn't as sore after. Like later, I did spend a lot of time icing last night. But overall, like the after wasn't too bad. This question I keep getting is how many sessions? We don't know. At least one, probably 2 to 5. I'm hopeful that I can get it done in 2, maybe 3 on this eye. We'll see though. How much it lifts. So you can see it kind of looks lighter now, but also they're so red and like bruised and swollen that it's hard to tell. But the way tattoo laser removal works is it kind of breaks up the pigment and then your body flushes it out over like 4 to 6 weeks. So I'm not going to get another session for at least 4 weeks, but it'll continue to lighten during that time. So I'll post updates of how it's looking. And what's the aftercare look like? So they just want me to put Aquaphor on it. So that's why my eyes also are more shiny and my eyelashes are more goopy, because I showered and I washed. It said to wait 24 hours and then you could wash with gentle soap. So I used my cleansing gel and just very gently, barely even touched my eyes, washed my face in the shower and washed my eyes, and then put on Aquaphor after. And then I think I'm more of a sweller than most people, at least for my eyes. And so I bet they said 3 to 7 days for the swelling, and I bet I'll probably be more like the full 7 at this point. And then the bruising can last up to 14 days. Honestly though, the recovery so far I feel like has been less bad than my saline removal, because my saline removal I just felt like was so much more itchy and irritated, and this is just very swollen. But other than that, like, I'm really fine. I'm about to go into work, so sorry to my patients. Hopefully I don't scare you, but let me know what other questions you have about laser tattoo removal for permanent makeup.
I would like to share with everyone how eyeliner tattoo removal by laser. Yes, it's possible to remove eyeliner tattoo as long as you can find an experienced laser specialist that they know what they're doing with the spot size and the energy, and someone that can manage and control the situation well, because it needs a sturdy hand, and because sometimes clients might jump, they scare and they move, so we have to control their lip and for safety. So this client got it done elsewhere, and then she got removal one section. I took the video and picture when she come back. It's played a lot because she had cotton ink. But if anyone that have iron tattooing that contain more iron oxide, it will take more sections. I would like to share.
So we are here with this patient. She came straight from Orlando just to have this eyeliners done. And Melissa, can you tell me a little bit why you choose us and what's the reason why you drive 3 hours just to do this right here with me?
Yes, so I had this tattoo for many years and I've been looking for someone to be able to remove it. And I've been looking online, TikTok, Instagram, and I found someone, but it was in Seattle, Washington. So
hello everyone, welcome back to my YouTube channel. So if you're seeing my video for the very first time, please kindly subscribe. It would really mean a lot to me. And also click or put your notification bell so you always get notified when I drop a new video. So today it's all about tattoo eyeliner. So if you have an eyeliner tattoo and you want to clear it off, or you have an experience, or you want to learn, stick around to this video and watch to the end. So today, what you should know before you commit to go ahead and removing your tattoo eyeliner. We have a lot of things we're going to learn in this video, so stick around and watch to the end. An eyeliner tattoo, also known as permanent eyeliner, is a cosmetic tattooing procedure, right? It is.
About my eyeliner all the time, so I thought I'd make a video about it. A lot of the times it's like, why are you wearing blue eyeliner? If you could try not wearing eyeliner one of these days, I think it'd look so pretty. Yeah, I wish I could. I can't. It is tattooed on, and one of my biggest insecurities and biggest regrets. I was 17 when I got my eyeliner done, and it was boyfriend's at the time sister. I was probably one of the first 3 people she'd even done it on. Honestly, not a good candidate in the first place. I have really oily eyelids, so more olive tone than anybody she had done it on, and so it just was honestly a disaster from the start. It has been 12 years since the first time I had it done. I did have her do a touch-up a year later trying to fix some things. So as you can see, like, I think it's this eye that is thicker and very blue, and then on the bottom here it immediately did that little spot where it migrated out from where it was supposed to be. I would love to get it removed, so if anybody's had their eyeliner lasered off or removed and had it work, please tell me who you went to. Show me some before and afters. I'm just too scared to commit to it and have it turn out worse. And then after, when she did the touch-up, she did some flesh colored to try to fix it, and that did help, but you could still see like the flesh colored ink. I did have 2 saline removals where they like tattoo in the saline solution to pull out ink. Once in 2020 and then once again in probably 2022, so it's been a while. Honestly, the recovery from doing that is so annoying. My eyes get so swollen and goopy for so long and so itchy, so that's why I haven't done it again. I just don't know how many it would take to actually get the results I want, and if it would just cause more scarring. I want to look into laser, but I just have been too scared and haven't found like anybody that has good before and afters to make me feel confident in doing it, especially with it being around the eye. I'm looking for any and all help, and I would love to get rid of it. Hopefully this lighting shows it well. I'll post some pictures too to kind of show you guys a little bit in more normal lighting, but I think permanent eyeliner is just the worst because it's so hard to remove if you don't like it. But if you do get it, find somebody that has a lot of experience that you trust with their before and afters. Let me know if you have any other questions about my eyeliner. It is blue. I don't put it on. I try to cover it up, and I hate it, but please be nice to me.
So an eyeliner is a cosmetic tattooing procedure designed to create the appearance of a perfectly applied eyeliner without the need for a daily makeup, right? So for so many people, it offers convenience, save time, and can enhance the natural shape of your eyes. So it is actually very beautiful for women because it's a permanent procedure. However, this is important to remember that an eyeliner tattoo is a permanent cosmetic procedure. So not a temporary beauty treatment, no. The results can vary depending on the technical skills as well and your skin type, the quality of the pigment used, and how well you follow the afterward instructions. Although many people are pleased with their results, so many people are pleased with their results, others may experience unveil lines, yeah, pigment fading or changing colors over time. So these are the things you should watch out for. And also infections, allergic reaction, or dissatisfaction with the final appearances. These can also cause eyeliner when you don't do it properly. So before deciding on an eyeliner tattoo, again, take the time to research the clinic, verify the technician's qualifications, review healed client results. Make sure you check their reviews, go to their page if they're on social media, and also check their reviews and ask questions about the procedure, the risks, and aftercare. Avoid making your decisions based solely on price or social media trend. So beauty should enhance your confidence, right? Not because a source of regret. It shouldn't be a source of regret. A well-informed decision is always the best beauty investment you can ever have, you can ever make as well. So make sure that you do your proper research and go to the right full professional, and make sure you do your research before you do any kind of procedure, either eyeliner or any kind of medical procedure.
I recommend Ziva. This is my second session for tattoo laser removal for my eyeliner, which was a horrible mistake and I shouldn't have did it. But numbing cream works great. This is, like I said, my second session. It is a very clean facility. She knows what she's doing. I love the aesthetic of the building. I really appreciate her and I would highly recommend.
A permanent eyeliner tattoo may seem like a shortcut to effortlessly beauty, yeah? But for some people, it becomes a lifelong reminder that every cosmetic procedure carries risks. That is true. And what looks perfect on day one can fade unevenly, change colors as well, blur over time, or no longer suit your face as you age. Trend lasts for a season.
Compromise a client's skin or even comfort. Unfortunately, many professionals attempted service without proper training, risking burns, scary or incomplete results. That's why advanced techniques and fully understand the skin, pigments, and also equipment is what separates beginners from real experts. If you want to remove your eyeliner, or if you are a professional who wants to elevate your career, gain confidence, and also offer high-value procedures like eyeliner removal.
While, as I said earlier, a trend lasts for a season, but a tattoo can last for years. Before trusting anyone with your eyes, remember that the cheapest option often becomes the most expensive mistakes, right?
For chronic dry. Comments like this are objectively annoying because they position themselves as an authority by speaking on behalf of others in their profession against mine, causing a lot of unnecessary fear and anxiety without providing any information or context. This image is the anatomy of an eyelid. This yellow line here is the skin, and it's about 1 millimeter thick on average, and the area where you should be implanting your ink. This is the meibomian gland. Its opening is along the base of the waterline, and it's what lubricates your eye. If you are implanting your ink in the proper place, it has to travel all through muscle and tissue to get to that gland and cause any kind of damage. The primary reason for chronic dry eye due to permanent eyeliner is by tattooing the waterline. This is an image of a client of mine with a healed lash line tattoo. The location of those glands are right along the base of the waterline. There's about 2 millimeters from that area to the lash line. The glands run up along the inside of the eyelid. It's the biggest reason why I don't tattoo that area, even if a client asks. Second reason is if an artist is being heavy-handed and they implant the ink too too deeply, of course, it's going to cause permanent damage, and it's likely going to cause some scar tissue as well. Permanent damage from tattooing an eyelid is, of course, a concern, and there are a lot of steps and safeguards within my booking process that keep clients protected. But the primary reason is due to uneducated and unskilled artists. This is the case in any field. Someone who knows what they're doing is very unlikely to cause harm or damage of this magnitude. So I hope this helps.
Beauty shouldn't cost your health, your confidence, or your peace of mind. So please kindly watch out and research carefully. Choose an experienced professional. Understand the risks and never let social media trend pressure make a permanent decision for you. Sometimes the greatest beauty choice is knowing when to say not yet. Is that clear? A few extra minutes applying eyeliner each morning may be small price compared with years of correcting a decision you rushed into. So please make sure you are ready before you do it. Okay, if you're still watching to this time, honestly, I'm so grateful and thank you for watching to this day. Have you subscribed to my channel? If you haven't, please do so. And honestly, I will be so grateful. You don't know how much that will mean to me. It means a lot to me. And put on your notification bell, and so that you always receive my posts whenever I drop a new video. If you love something about cosmetic, a lot of contradiction videos, just make sure you follow and subscribe. So listen, these are some of the disadvantages or some of the side effects of eyeliner tattoo. Results are difficult, especially, and very expensive to remove or correct. So most of the times they are difficult and expensive to remove or correct. And also, pigment may fade into blue, gray, or green tones over time. So they are actually not a good result or good effect on an eye. Not even the eye is a sensitive part of the body, so it is not just good for that.
6 years ago today, I made one of the worst decisions of my life. I got my eyeliner permanently tattooed when I was 20, and permanent makeup was just starting to become trendy. If you're following me for the eyeliner tattoo laser removal update, then this video is for you. In June 2024, I got my first laser tattoo removal session on my eyeliner at the Arbutus Clinic in Vancouver. I have a full video about this process and my experience up on my YouTube channel, so check it out if you're interested. But initially, the eyeliner tattoo scabbed a little bit, and then the scab kind of fell off and it's slightly faded. The technician at the Arbutus Clinic told me that I need around like 4 to 5 laser sessions to get it fully removed. October 2024, I got my second laser tattoo removal session on my eyeliner, and all of it was through the Pico Way laser. I think that's what it's called. I'll double check and write it in the caption. But I got this session done at Clinique Face MD in Montreal because I moved here. The process and my experience at Clinique Face MD was exactly identical to my experience with my first laser session in Vancouver. I would say that the procedure itself is very uncomfortable and painful because they can't really numb your eye area, but it's really quick. It's literally like a couple of seconds. Second session, I was able to see a lot more fading, and this is what my eyeliner tattoo looks like now. I was supposed to go for my third session 4 to 5 months after my second session, but I actually got lazy. That's why I didn't have any updates in the period in between that. I'm going to wait until after summer to get my third session done, so I'll update you guys then. But for now, I'm actually really happy.
Don't get your eyeliner tattooed. As someone who had it tattooed like 10 years ago, it looks hideous. This side looks okay. That side, oh my god, biggest regret. It does not go away. They say it goes away in a couple years. Not mine. The underneath ones did. They went away like instantly, like within a year. But the top, god, I hate it.
So there are so many side effects on this particular procedure. So infection is possible if proper hygiene isn't followed, and allergic reaction to pigment can occur in some people. That's true. And the tattoo may blur or spread slightly as the skin ages. Yeah, the tattoo may blow or spread slightly as the skin ages. Also, it may no longer match your preferred makeup style in the future because strength doesn't last. I said that earlier. And then touch-ups are often needed every few years.
Unacceptable eyeliner mistakes. This eyeliner mistake should never happen in front of makeup. I want to show you this healed result, not my work, and the pigment migration due to very heavy saturation on the thinnest skin of our body, the eyelids. Bruising that happened during the procedure forced the pigment migration, and this damage is permanent. It can be lasered off, but it's problem. Please remember, large eyeliners design always age poorly. Imagine those were your eyes. And my dear clients, please remember, less is more.
Okay, I don't think a lot of you get the point of the first video of me saying I regret getting my eyeliner tattooed when I was 19. It's not because I didn't get it darkened every 2 years that I started thinking that it looks ugly. No, people change. Back then I was wearing black eyeliner every single day of my life and thought it was a good idea. But now I grew to like experimenting with makeup, colorful eyeliner, colorful eyeshadows, stuff that like makes it harder when I have my eyeliner tattooed underneath. So like I still stand by saying I regret getting it done and I do not recommend it.
Do you see my eyes? Do you see these lines? My eyeliners are permanently tattooed. And before anybody says this is a genius idea, I want to tell you, girl, never ever get eyeliner tattooed because I got them done I want to say 6 years ago and they are still there. The lady said it will fade away completely within 2 years. They are still there, very much still there after 6 years. Color is a bit off and they're not looking crispy. I'm not so mad about the shape, but sometimes I just don't want them because like if I don't wear makeup, they look kind of weird. So don't ever get your eyeliners tattooed.
I cannot stand this stupid eyeliner. Look at how dumb it is on my face. I got it done 8 years ago. It seems like she did a permanent one. It's awful. I remember I got a forehead lift. So since it's lifted, you can really see how bad the eyeliner is. My goal is to do the first session this month. So if you also want to get rid of your old school, out of style eyeliner tattoo, follow me. I will show you my entire journey. I think they have to do it like 2 to 5 times. At least get it started next week. Get rid of this shit.
My biggest regret in permanent cosmetic procedure is definitely my eyeliner permanent. It's a tattoo eyeliner. I did the research. I asked the right question. Everything looked fine at first. It was amazing. But the next day I woke up with some darkness spot. I was like, what it is this some bruising? I contact the professional and then I realized it never went away. And this is when I learned that there is migration pigment. Subtle but permanent to look tired every day. This is not a horror story, it's my real life experience on it. Over the next video series, I'm gonna explain why it is so important, the tattoo on the eye area, what kind of pigment you should use, and what I wish I knew before I did it.
Also, pore techniques can leave scars on permanent cosmetic imperfections, and corrective laser removal near the eye is complex, as the medical professional said, and should only be performed by highly qualified specialists. Exception warning notice. Permanent makeup is still a tattoo. While many people are happy with their results, others experience disappointment. Yes, because of poor techniques, unrealistic expectations, fading, or complications. So, never choose a clinic based on price alone. Ask to see healed results. Ask for reviews. Verify qualifications under the aftercare, and understand the aftercare process. And then make sure you are fully informed before making a permanent decision. Your eye deserves patience, not pleasure. An eyeliner tattoo can save time and enhance your look, but it is a permanent cosmetic procedure that should never be rushed. Don't rush in putting or piercing any part of your body especially your eyes. Your eyes are very sensitive, right? While many people are satisfied with their results, not everyone is fortunate. Others experience uneven pigment, especially color changes, and a lot of them. So different reactions they based on skin.
So eyeliner gone wrong 24 hours after I have a migration pigment. Of course, first thing you do, contact your artist to look for what can be done, which I've done. However, my story is I didn't get any answer back. I got ghosted on the phone, email, DM for months and months and years. So what do you do if you need the right guidance? Look for other experts like in Facebook group and ask for help. So this taught me the importance of after service. There's a responsibility to the practitioner that when the procedure is done, there's still a service that need to be made afterwards. So now this is a question I ask a lot. How do you manage risk? What if happen? What do you do? It's part of the service, it's part of the experience. It taught me a lot. I'm really grateful of that. And next video, I'm gonna tell you how to fix this.
Do I regret getting permanent eyeliner? I have the top and bottom. The top is not that noticeable anymore, so I still use a little bit of corner eyeliner. The bottom eyeliner, it's like a yes and no. I've actually never regretted it until the past few months. I'm going for that clean girl makeup aesthetic vibe, and I want to wear less makeup, and having that doesn't really help because, well, it looks like I'm wearing makeup. So I have just recently started to kind of regret it, but I didn't regret it for the past 9-10 years.
Go this path. I think it is important to understand the risks involved in any elective procedure. You do have meibomian glands both in the upper and lower lids. They are structured a little bit differently. There is an unequal distribution, but overall they serve a similar purpose. And yes, liner tattoo can damage both. So if you are insistent upon getting eyeliner tattoo, know that you can cause permanent damage to the surface of your eye. Make sure you are getting annual meibography with your eye doctor if you go this.
There are even, if you have dry eyes, you might want to hear this before getting an eyeliner tattoo. Yesterday here in clinic, a patient asked me what I thought about eyeliner tattoos. And honestly, I hadn't looked at the literature in a while. So I went down the rabbit hole last night. Here's what's interesting. Permanent eyeliner isn't just placed on the skin. It's placed right into the eyelid margin, the same area where your meibomian glands live, the glands that keep your tear film stable. There are published reports linking eyeliner tattoos to chronic eyelid inflammation, meibomian gland dysfunction, and worsening dry eye symptoms. There are even rare case reports of pigment migration and corneal complications. These are anecdotal or case reports. Most people who get it probably do fine, but it's not zero risk. If you already have sensitive eyes, dry eye, blepharitis, or you've had laser vision correction, it's definitely something to think carefully about. Your eyelids aren't just cosmetic, they're functional tissue.
Yo, Shane, I'm actually low-key scared. Can you give me any tips or what? Can you give me any tips for tattooing someone's eyelids?
I can't imagine how bad this hurts, not to mention that eyelid tattooing is going to cause a lot of problems in the eye. Believe it or not, there's a lot more people that are getting these eyelid tattoos than you think. And I'm not talking about this particular tattoo. I'm talking about these cosmetic tattoos. This is permanent eyeliner tattooing, and it is going to cause a lot of problems with the meibomian glands, where we've actually seen that people who get these types of tattoos will have meibomian gland atrophy, which can leave you at a higher risk of severe forms of dry eye. There have actually been multiple studies done on eyelid tattooing and how it induces meibomian gland loss and tear film instability. The eyelid is a very delicate structure, and the eyelid skin is the thinnest skin in the body. You can actually damage a meibomian gland just from squeezing too hard on the eyelid. So just imagine what cosmetic tattooing could do to the health of the meibomian gland. If you've never seen a meibomian gland before, this is what they look like in both the lower and upper lids, and we rely on these glands because they produce the oil or outermost layer of our tear film. The oil layer is a protectant which prevents our tears from evaporating into thin air so that we can keep our tears on the cornea and protect it from the external environment. When these procedures are done on the eyelid, we notice that the meibomian glands start to swell shut because of the lid thickening and inflammation that happens after the procedure, and this can lead to the death of the meibomian glands, and the worst part about this is that you can never get these back once they die. Reduced functioning of these meibomian glands over time causes more instability on the front surface of the eye because of the lack of protection, allowing for inflammation to course around the eye, worsening your meibomian gland dysfunction and blepharitis, leaving you at a much higher risk of severe forms of dry eye that could even affect vision. Whether you're trying to get tattoos on your eyelids like this or getting tattooing for permanent eyeliner, make sure you know your risks so you don't leave yourself at a higher risk of dry eye.
Somebody just asked me about tattoo eyeliner. Never, ever get tattoo eyeliner. This is why. Here's your eyelid. This is your eyelash. Tattoo eyeliner, a lot of my patients get it right here under the eye. They're not getting it on the waterline. They're getting it right underneath this eyelash. Each eyelash has an accessory oil gland called the gland of Zeiss. That gland of Zeiss is responsible for secreting oil to help lubricate and to keep that eyelash supple so it stops breaking. So unless you want to have short, brittle, breaking lashes for the rest of your life, maybe you should get tattoo eyeliner.
I hope you're learning. I hope you've learned from all these videos. I mean all these clips of videos. I hope you learn. And also, please, before making a permanent decision, research your technicians, understand the potential risks, and have realistic expectations.
You guys, my scabs came off and my eyeliner is so light on the top. You can barely see it. It kind of just blends in with my lashes. I am gonna at least do another, this eye needs a little bit more, kind of at the top. But it's got like no ink on the bottom. So, I'm thrilled. I knew I was gonna have to go back for the bottom. So, we're gonna have to do that one again. But look at how light it is. Like, I have to show you guys a before and show you now, like I could cry. It's so much lighter. Like, I feel like it opened my eyes so much. Yay, day 11, no more scabs, fully healed. Session 6, eyeliner tattoo removal.
Beauty trends change, but permanent makeup can last for a year. Make an informed choice. Your eyes deserve careful consideration. So I'll see you guys next time.
Okay guys, so I'm going to show you my eyes today. It didn't catch under here, so I have got to go back and catch under there, and I think there's a little bit slightly just here. But can we just look at this eye? Like, there's not really any black at all. They are still red and a bit swollen, as you can see, and I think there's a bit of swelling that's come down under here as well. But I am so impressed. Like, look. We've got to go back and get just along the line as well, because like that's the hardest bit, to get along the lash line. But like, guys, if you watch yesterday's video compared to yesterday, I'm well impressed. I'm not gonna lie, it was freaking painful, and I mean we're on a 10. My heart was beating through my neck, but it's quick, so it's really painful, but it doesn't last long and it is quick. But yeah, it's really, if you suffer with bleeding from eyeliner tattoo, it's definitely worth it, absolutely 100%. And I'm gutted that we didn't catch this bit, because like, look. But yeah, I am gonna go back in 3 weeks and we'll get there. But honest to God, guys, my journey to bright eyes is just so near yet so far. I'm very, very excited. So yeah, I just thought I'd give you an update on what they're like today. I'll upload the video of what they were like not long after. But yeah, happy.
So guys, if you're new here, please kindly subscribe. Please kindly subscribe. It means a lot to me. So I hope you have learned from these videos, and you have learned from what people have said, And thank you for watching to the end. I'll see you guys in my next video. I love you all. Bye.
Look up. I'm here with Ash, who's volunteered to be our model. To be showing you all how to protect the eyeball during an eyeliner laser tattoo removal session. Ash, how are you feeling about having a shield inserted onto the eye?
A little bit nervous, I'm not gonna lie.
Yeah. Alright, so over here what I've got is our ocular shield. An ocular shield is used to actually protect the eye from the laser itself. The way that this works, this has got a nice rounded edge. When that's inserted under the eyelid, it's going to cover the actual eyeball itself and prevent that laser penetration from going through. What we're going to do is we're going to lay you down and we're going to show everyone how it's done. Okay. We have got some adhesive eye shields, so we're going to be covering one of your eyes. Which eye would you like to treat, Ash?
Let's treat this one today.
We're going to be covering up the left eye with this shield here. So with the eyes closed, just popping that there on. We're going to be lubricating this eye here with the sodium chloride solution. So I'm going to have you opening up. I'm going to insert the actual shield. So I'm going to talk you through this. What I'm going to get you to do, Ash, is I'm going to get you to look up. It's okay, looking up and looking down. So it is completely normal to get resistance from the eye. Obviously it's not a natural thing to have something up the eye. From here, we can then laser directly on that shield and it keeps that eye protected. Right, zipping it out. How did that feel?
A little bit like annoying, but I wouldn't call it uncomfortable.
Yeah, I'll wash the eye out now. Before and after every treatment with the shield, we do a soap wash. We also then do an alcohol wash, and then of course we're washing it with the saline solution.
Did you know there's a rare eye condition where you go blind after getting a tattoo on your skin? If you are one of 29% of Americans who has a tattoo on their body, you may want to listen up. Keep in mind this is a relatively rare condition, but I also think it's quite underreported as more and more cases are getting published as ophthalmologists are becoming more aware of this condition. Mechanism not quite well understood, but it is something along the lines of you get a tattoo on your skin, the ink in the tattoo is not FDA regulated, so you don't really know what's in the ink. There are small studies that show that perhaps the cobalt or maybe some metallic elements in the ink may be inciting factors, causing a delayed hypersensitivity reaction and causing widespread inflammation on the tattoo and on the eye. So what typically happens is you get your tattoo, and weeks and months later you get inflammation on the skin around the tattoo, becomes red and raised, and then shortly after you start losing vision in both your eyes. Patients typically need to be on immunosuppression, one form or another, whether it's local or systemic. There are reports that removing the tattoo in its entirety with a skin graft in place can induce the disease into remission. It is not recommended that you use laser ink removal, as that disperses the pigment granules in your tattoo, making things worse. Hope that was interesting and useful. If you get a tattoo and your eye starts looking like this, go see your ophthalmologist.